more rambling. Maybe I'll get this one up by the end of the day. I don't know, it's kind of late. I was procrastinating. We put up a fence in the backyard, and just hauling the wood from the front of the house to the back took a lot out of me. That was about all the energy I had for the day, so, yeah. Got a couple of comments on my last video. Apparently people think that I should look people up on Encyclopedia Dramatica before I decide to associate with them. Fair enough. But then you'd have to go to Kiwi Farms and 4chan and all other places that they might have a documented case of lolcalitis. Lolcalitis? Whatever. Whatever. You know what? So, yeah. I had a discussion with Joyce Sparkle's BS, and I was actually told to have that discussion before she asked for it. I was told to have that discussion by Nick Bravo, who really likes watching her. And so, yeah. And then I make that video where I say, well, she interviewed me and it's been 2 weeks and she hasn't posted it. I feel like she just wasted my time, even though in that 2-day series of texts back and forth, she was, saying, I hope I don't waste your time. And yeah, I thought that was ironic. And, I made some points that maybe I wanted to see on other channels in that discussion, because I don't really want to have a big drawn-out fight with a therapy company on my own channel, because I don't feel like that added stress in my life right now. And I was kind of upset that those points didn't get out there by anyone because she sat on them. And so I make that video yesterday, and then I get comments like Jennifer Martino, longtime viewer of my stuff. She's like, Joy Sparkle, Mike, no, not even once. I'm like, and then I got a comment from Bruce Shepard. Longtime viewers of my channel will remember him as the Stigmadane, somebody who I've visited in real life on a road trip, and we went to Chili's. And in his post, it was a really long post, but at the end of it, he said that he had a friend that died because an incompetent rehab facility turned him away due to having open wounds. And just side note, I realize right now, as I'm saying all this stuff, that the circle of people I'm associating myself with looks a lot like that island of misfit toys. And I wonder where I fit into that. As far as Christmas shows are concerned. Oh, it's almost Halloween, so Christmas shows should be popping up back on TV now. Pumpkin Spice Forever. Anyways. So yeah, Bruce said that his friend was turned away from this rehab facility for having open wounds. And then he said they should have a nurse or licensed physician on staff to take care of those kinds of issues, because it cost the life of an individual. And that is the basis for this ramble here. I don't know how much it would cost to have 24/7 an extra nurse and physician on hand to be able to treat open wounds. Also, the facilities that are required for treating open wounds in that manner. I mean, they'd have to have their own little surgical office where they could do minor, cleaning and packing of wounds and whatnot. But in my experience in a lot of residential facilities and a lot of other emergency care facilities, as an addiction counselor, I've seen many people turned away for having open wounds, and not all of them are as a result of their drug use. Of course, you'll have heroin addicts who are needle users who will have abscesses, and if it's just a tiny lump, most nurses will let it go. But if it gets to a certain size, or if they mark it and it grows, they will basically set them up for a discharge and tell them to go to urgent care so that it can get drained and they can have wound care. But also, a lot of emergency facilities like detoxes and emergency rooms and whatnot, they will have homeless people who will get injuries that will get infected and they'll grow, and they can't handle that. They're not set up to. The detox isn't, but sometimes even you'll see in an emergency room, they'll be like, well, take this, this, and this, and we're going to set you up for a discharge in the morning right after we hand you a ham sandwich. And we need this emergency room bed. You're not really appropriate for this level of care. They'll treat them like they're just shelter seeking. Like, you just want a bed and a ham sandwich. And we can't have you long term here because, if your infection gets worse or if it spreads to other people, then we're going to be liable. And liability is a huge thing that weighs on all of these decisions. And it seems horrible because medical facilities should be able to treat all sorts of maladies. That's like our expectation as medical consumers. But mental health facilities and detoxes, even though a lot of the things that are on the medical side can be like expected, such as abscesses on a heroin addict, or say head wounds from bashing your head into the wall in a mental health facility. You can expect that to happen, but as soon as those things present themselves, the facility says, well, this person is overqualified for our care. We need to send them to somewhere else to get that treated first, and then once it's better, they can come back. And it's all about liability and whether or not it's within their scope of practice to be able to treat that certain aspect of what they're going through. So, what I wanted to bring up on top of that is that there are other reasons that I've seen people discharged from rehabs and from detoxes, right? And these things are completely something that you should expect. But it is so expensive to have a facility that can treat everything, right? Like fucking everything, and have a nurse that is qualified to do these things, or a doctor on hand all the time. It is so expensive to have that there's a lot of facilities that just treat people who have just the addiction and none of the worst of the symptoms that can happen with it. So, for instance, if you see somebody have a seizure at a detox, and then the seizure's over, and they're, the nurses that are there are putting like oxygen on them and whatnot, that person's going to the emergency room, even though you should expect that at a detox somebody's going to have a seizure every now and again. That person's going to the emergency room for a checkup. If somebody has too high of high blood pressure outside the range that they can control in those places, they're going to the ER too. One of the things that really, really pisses me off is that in my state, there seems to be very little care for alcoholics with diabetes. As soon as somebody is identified in a rehab or a detox as having diabetes, then all of a sudden they're too much of a liability, because an alcoholic who has diabetes is like 100 times more likely to have a seizure. So they really don't want them on the premises because of liability, right? But you'd think that if their whole purpose is to care for addicts and alcoholics, that they should strive towards being able to take care of that situation, especially because it's not all that uncommon. I would say 3 out of every 100 alcoholics has diabetes, at least to the point where it's something that they will get discharged for. I'm talking the people who have to manage it with injection insulin, people who are prescribed metformin, those kind of things. They will get discharged for as quickly as possible. Now, it might not be considered a caring thing to do to discharge them immediately, so they might be set for a discharge, after having a ham sandwich and being able to stay in during the cold of night in the winter. But as soon as daylight happens and they've had that sandwich, see ya. Your problem is too big for us to handle. Another one that pisses me off, especially in rehab facilities that have med cabinets, and have qualified personnel, QMAP. It's a statewide thing where, like, you have to be qualified to be able to pass medications. I think they should have a Pyxis system. Pyxis is kind of like a catalog of drugs in a big dispensary cabinet, kind of like a vending machine for drugs, right? So someone shows up, they're homeless, and they've had their drugs that are prescription drugs stolen from them. They will be discharged as soon as they're stabilized from that rehab facility. So if it's Keppra, which is a lot of, even more than you see diabetes in alcoholics, you'll see people who are prescribed Keppra for seizures, even though, if you think about it, the reason why they're having these seizures is because they're going through withdrawal and their blood pressure is spiking. They're not really having epileptic style seizures. They're having alcoholic withdrawal seizures. They're prescribed Keppra to prevent them from having a seizure, right? And it's like a Band-Aid. It's not really treating the core issue of the alcoholism. It's actually, in many cases, enabling it. But anyways, you'll see people who are prescribed Keppra, and they show up at a detox, and their Keppra was stolen from them on the street, right? There is no Keppra on hand that can be given to them. Other clients might have Keppra in the medications room or locker or cart locked up, but you can't use another client's medicine for other clients. You can't do that. Even if you have their medical records and you see that this person needs it, there's no sharing, right? If it's within a bottle with a label with a particular person's name on it, you can't give it to the other person. And none of these places have just a standard locker with these medications that people get discharged because they don't have them and they're very needed. None of these places have that. And so you see that with Keppra. You see that with mental health problems that are needing things like Seroquel, which I just think should be standard. They should have Seroquel in the cabinet because there's so many people who are homeless, have a mental health problem, and have alcoholism. Those three things go together. They correlate very well to the point where you can predict that every day at certain facilities you're going to see someone discharged because they don't have their Seroquel, right? And you could call the doctor and say, doctor, does this guy have a valid prescription? The doctor will say, yeah. But say they're on Medicaid. Medicaid will only allow for their prescription to be filled every so often. So you can't fill a prescription you picked up until like 21 days has passed because it's like a 30-day supply. So you have to wait at least 21 days in order to get your next supply. Well, if you picked it up and then the next day it was stolen, your ass is like 3 weeks until you're going to have your medication, right? That sucks, right? But what also sucks is you try to go get care at some facility that you need to get care at, and they're going to discharge you for not having your medications, even though they're a medical facility that should be able to handle this. And that pisses me off. I wish I could change the world with a magic wand and make that not the case. I wish that thousands upon probably millions of dollars were spent on each facility so that they were able to handle this, and they can't. Another reason why people get discharged from rehab centers and from detoxes that I think they should be able to handle is the inability to ambulate. That means walk, for those of you who don't speak medical terminology. So it's okay to have a walker. It's okay to have a cane. It's okay to have a wheelchair if you yourself can get yourself in and out of it and you don't need help getting in and out of it, and you basically are going to a facility that has wheelchair access, handicap access, which, by federal law they have to have, at least something. But the moment it gets realized that you can't walk on your own, you will get discharged to go seek treatment at urgent care or the emergency room. This could be like somebody has a severely sprained ankle or a broken leg that keeps getting aggravated because they're homeless and they sleep on the streets, and it's really hard for them to get across town to a shelter, so they're basically hanging out in the same neighborhood as their favorite hospital that treats them well. But it also could be they had a walker or a cane or a wheelchair and it got stolen from them while they were sleeping on the streets. It could be that they have withdrawals so bad that they are unable to get up from their bed to go to the bathroom and make that walk. And if that's the case, they will be sent out. It's like a lot of these facilities have a very narrow focus as far as what their scope of practice is. And if somebody has predictable withdrawal symptoms that are so bad that it falls outside of that scope of practice, ship them out, discharge them. And a lot of times you can predictably assume that these people are not going to go to the emergency room. They're not going to get care. Sometimes they get transported by an ambulance or by a driver from that institution, but sometimes they're just walked out the door, with no extra care taken to see if they're going to go manage that problem that got them discharged. Especially with diabetics. especially, they'll just be walked out. Like, you know, you shouldn't be a diabetic drinking. Now you're getting walked out. So, yeah. Bruce went on in his response to me. He says that he's been active with some activism about reform of rehab centers in Florida, which I imagine probably needs a lot of work because it's Florida. We all know stories about Florida Man, right? So they were making a documentary about this this activist group called Hands and Feet in front of City Council, talking about the issue of Suboxone keeping people addicted. And the last thing he says in this post is that it's supposed to be a weaning type drug, but some doctors keep their patients on it. And this is true, that some doctors will take a view of certain patients that they are going to be using this drug, be it methadone or Suboxone, for life. With methadone, built into the prescription pretty much is a titration process where you start at a certain level and then you're given a prescribed number of weeks that you're going to be on that level, and then it's going to go down, it's going to go down, it's going to go down. If it gets down to a point where it's not managing your withdrawal and you're in pain and you relapse and you use heroin on top of methadone, various actions could happen. You could be taken out of that methadone program, but most likely they will consider that to be, well, they titrated you down too quickly. So what happens is your dose goes all the way back up to the beginning, and you start titrating down again. If that happens too many times, that cycle of you get down to a certain level and you start relapsing, you could find yourself in the care of a doctor who just takes the approach that you're going to be on methadone for life. Suboxone and methadone are also being prescribed to people for pain management for lifelong illnesses as well now. And so some people are getting prescribed it for a different purpose than being weaning them off of it. You know, it's actually their pain drug because it's the one that works for them. And so not all cases are such that the doctor thinks that it's in the future of that patient to get off of Suboxone or methadone. Maybe that was the intent of the drug when they were manufacturing it, but lots of drugs will find uses beyond what the drug was initially prescribed for. Suboxone and methadone being used for long-term pain management instead of just weaning people off of harder drugs. That's one of those cases where, like, doctors were looking for something, you know, other than giving someone OxyContin to handle their pain issues. Something that they thought would be less addictive, and come to find out that some of these drugs that are used to wean people off of opiates, themselves being opiates of a different class, they're also addictive. they come with their own problems. And I've heard that getting off of methadone is harder to kick than just going cold turkey off of heroin if you are trying to do it in a pinch. So, yeah. The world isn't black and white. That's all I'm going to say today. I've got like 5 minutes to try to upload this video to beat the midnight cutoff and actually keep it on this day. That's what procrastination will do to you. Hopefully one more long sleep this weekend and I'll be able to bounce back and, you know, start kicking ass and taking names. Talk to you all later.